Today I'm going to talk to you about in-office treatments that I really like. Things that I consider to be trusted, time-tested, and very important part of your overall anti-aging strategy. My name is Dr. Karam. I'm a board-certified facial plastic surgeon, and I'm also the founder and creator of KaramMD Skin. Last week, we shot a video that went through all the trends and procedures that I think we really can do without and hopefully we'll never see again. But what I'm about to talk to you today are things that you definitely want to continue, and I think, frankly, they're not going anywhere. They're gonna stick around. These are things that are done in estheticians, practices, dermatologists, plastic surgeons, and medical spas. I'm gonna go through in no particular order of priority or importance, but just stuff that I think is useful. Now, I'm gonna also indicate for you where they are beneficial, how you should use them, when you should use them, etc. So you get a lot of good information around the topic as you navigate and ask your providers at home to help you out with these type of things. Most of these treatments are specific for skin rejuvenation. And the reason for that is when it comes to sagging, there's nothing really better than surgery for that. So in that video that I just mentioned, we talk about all the things that fail to address skin sagging and laxity and all that kind of stuff. Here we're talking about skin aging, which is really about keeping the skin looking wrinkle-free, pigment-free, having it have suppleness and luminosity, all the things that make skin look young, which is equally as important as all the things that make the face look sagging and neck sag and all that kind of stuff. So we're forgetting about that side of it. We're focusing on this. Everything else really does have benefits on skin, and I want you to know what those things are. One other thing I think is important to set up here is just like everything related to good health comes down to what you do on a daily basis. If you're trying to be physically in shape, you want diet and exercise, and you want to do it consistently and daily all the time. But then there's boot camps, right? There's things that you can do a week or two at a time that are going to jumpstart things, that is going to help you get in better shape, etc. Everything that we're about to talk about is going to fit into the boot camp type category. But I want to say your daily diet and exercise, your foundation for great skin starts with two things. One is sun protection, which is absolutely a must. You cannot have great skin if you're getting blasted by sunlight because UVA is responsible for at least 70 to 80% of skin aging. So thins your skin, loss of collagen, discolorations, pigment, not to mention skin cancers, etc. But really at the end of the day, sun protection is a non-starter if you really want beautiful skin. Number two is daily skincare. Skincare, as I've described in many videos, comes down to the use of the right actives, things like retinol, vitamin C, niacinamide, certain peptides, hyaluronic acid, lipids, pigment-reducing botanicals, and you've got yourself a very comprehensive, very meaningful, and very active skincare routine. Everything that I just mentioned in there, by the way, happens to be the things that I included in the KaramMD trifecta because I realize it's hard to do all those different components, and I put them all together in a three-step trifecta, which makes it very easy to stay consistent with and do it on a daily basis. So for more information, definitely check out our website. But enough about that. Let's break down the procedures that I strongly recommend in office. Number one on that list is microneedling. I'm a big fan of microneedling. Why? Because microneedling causes the skin to respond to those tiny little needles that are piercing the skin by a healing response. Healing response means collagen production. And remember, the name of the game is that you are losing collagen with age and your skin is thinning and becoming more lined with wrinkles, etc. as a result of that, and you're going to stimulate collagen any way you can. All those products that I just mentioned in the skincare, that's building collagen on a daily basis. Microneedling is building it also through the process of injury and healing. So microneedling is a high reward, low risk type of a procedure. You can get it done anywhere that's reputable, use a sterile technique, etc. But it's not a difficult procedure to come across. Number one thing to keep in mind is it's meant to be done in a series, so like every 6 weeks or so, you're gonna wanna do it. My wife, Netta, has been doing microneedling for her neck because genetically she has kind of a thinning quality to her neck, so she decided to be proactive with it. And starting even in her 30s and 40s, and now she's 50, has been doing microneedling on a regular basis in addition to putting the trifecta and the topicals on her skin. So that combination has kept her skin really supple by stimulating collagen, keeping elastin fibers up, keeping the skin structure from thinning and becoming crepey and weakened. Microneedling is a beautiful treatment, and that leads us to the next category, which is microneedling with PRP. The only difference here is that you're adding growth factors derived from your blood back onto the tissues. So what you do is draw the serum, get your PRP, then you do the microneedling, then you put the PRP on the skin, which then get absorbed in these tiny little holes that are created. And as a result of the growth factors that are in the plasma, the PRP is going to stimulate more collagen production. So it gives you even more efficiency of collagen stimulation and boosting. You take it one step further, you can also add radiofrequency to the mix. So microneedling with radiofrequency. Now this is a completely different device. And the concept here is that by adding RF or energy, you're going to get even more stimulation of collagen by creating a larger area of injury and getting the skin to stimulate. Now, I've had multiple videos on the dangers of microneedling with radiofrequency, specifically like Morpheus 8 and some of the other ones that tend to go deeper. And the reason why that is because we're talking skin here. We're not talking about tightening the face. As I mentioned earlier in the video that you should definitely check out, that when you are going at that deep level, you're not really getting the skin, you're going into the facial fat, and as a result, you're losing potentially the target area and potentially causing damage to the facial fat, which is precious, and you definitely don't want to lose it because it keeps the skin looking supple. And I have seen so many people have concerns and problems with radiofrequency microneedling, but that's the ones who've gone deeper with it. So the number to keep in mind is stay within 0.5 to 1 millimeter. That's basically the thickness of skin anywhere on your face, and even more shallow on the neck, so less than 0.5 on the neck. And if you keep those parameters in mind, you can add some radiofrequency to it, and you're not gonna get the negative effects that I speak so much about or that you hear about and have seen so much in the comments, etc. So microneedling, 3 versions, definitely think it's a procedure that is going to stay, and it's definitely a solid way of stimulating collagen from time to time. All of these are meant to be done in a series, so ongoing is ideal. Next category is chemical peels. I love chemical peels. I've been using them for over 20 years. They're generally done in estheticians' practices as part of facials. They're done in derm practices. You usually get a series of them as well. Typically, you want to do the light ones. When you're doing a series of light chemical peels, salicylics, glycolics, Jesners, even light TCAs, what you're doing is through a chemical process, you're exfoliating and removing the top layer of the skin, the epidermis, and maybe even a touch of the dermis. But what's happening with that process is you're removing the thickened layer that creates dullness to the skin. It's being peeled away. Any pigment that happens to be in the upper dermis gets improved. So fine lines and wrinkles can be even improved. Skin texture feels better, feels smoother and softer. When you get down to the medium or deeper, you're really needing an expert to do a big time downtime, 2 weeks to a month. That's really not practical for most people. When you're doing it in these light versions, there's not much of a downside. Now, if you have darker skin type, you gotta be careful you don't do it too frequently or too deeply. There's some caveats to it, but generally really light chemical peels, hardly have any downtime associated with it, and definitely do get the job done of exfoliating the skin, improving texture, fine lines and wrinkles, discoloration, and ultimately can help with stimulating collagen as well. Remember, the name of the game of skin anti-aging is do whatever you can to stimulate skin collagen. That's really important. So there's a common theme that comes through this. Now let's talk about lasers. Now, lasers is a broad category. There's a lot of different types of lasers. So I'm going to categorize this into 2 groups. Non-invasive lasers and invasive. So in the non-invasive category, we're really talking primarily about light. Now, light can come in the form of IPL and BBL. These are just 2 different brands, but basically intense pulse light or broadband light is used for addressing pigmentation. Brown pigmentation, which is sunspots, can be broken up by using certain wavelengths of this light through the IPL and BBL. So if you have red discoloration, the BBL can really be useful, IPL as well, for breaking up small broken capillaries and getting that reddish color out of the skin. Very effective treatment. Definitely using it in series is the way to go. You want to do anywhere from 3 to 6 depending on the circumstances. So those are very good treatments for that particular area. Now remember, when we talked about pigments are constantly being produced at the deep level. So if you wipe them away with your IPL or BBL, 6 months later or 3 months later, a year later, they're back again. This is why skincare is so important, because when you're using retinols, vitamin C, those botanical lighteners that I mentioned, even niacinamide, what you're doing is you're suppressing the production of new pigment. at the melanocyte level, which is the level that creates melanin. You're suppressing it. You're basically breaking up that pathway. So when you break it up, you clear it with a laser, you're not getting new ones being formed, your skin's gonna look more clear for a lot longer. Now, a lot of users of the trifecta, they get to a place where they don't even need IPL or BBL anymore because their skin has just improved the pigmentation. There's like 6 different things in that particular product that helps improve pigmentation. So you get to a place where your pigmentation isn't being produced, it's gonna be a much more stable, long-term, clear tone to your skin, which is what we all want, right? So that's really important, but it's definitely a good jumpstart kind of a tool to use those particular lasers. Very, very good, but make sure you're in the hands of somebody who knows what they're doing, because if you don't, you could definitely get burns from them if you're using the wrong settings, going too strong, darker skin, etc. One caveat is if you have melasma, don't use these particular lasers. They are definitely going to stimulate and create exacerbation. My wife, who has melasma, we did a lot of BBL on her back in the day, thinking, you know, from a collagen stimulation point of view and all that kind of stuff, they would help. But in fact, it made it worse. Now, again, could be settings issues or whatever it was, but definitely really fired up her melasma. So I generally would say melasma is best treated in the ways that I discussed in my previous videos, which I think, you know, her melasma is under incredible control using this approach that I've shared with you. So if you have melasma, definitely check out that video. Now, in the invasive laser category, you have 2 wavelengths, CO2 and erbium YAG. To me, CO2 is too much to use it on the entire face because the non-specific thermal injury, as they call it, causes too much redness and swelling, too long of a recovery, etc. It used to be very popular, but it would take like almost a month, sometimes more, to recover from it. Today, everyone's busy. They don't want anything that long. So most CO2 lasers have become fractionated, like in the way of Fraxel and things like that, to decrease the exposure of the skin to the CO2, decrease downtime, but also means you get less of an effect. Now, if you want full field resurfacing, which I really, really love, erbium YAG is a better approach because erbium YAG is a little bit less inflammatory, a little bit less heat involved in the process. So as a result of that, even when I do the deep resurfacing using the Contour TRL by Cyton, within a week or 2, the skin is looking great, and you've literally removed down to the upper dermis, completely removed it and let new skin come through. But because of the lack of thermal diffusion and injury, you recover much faster. So the Cyton Contour TRL is probably, I would call it like kind of the Lamborghini of skin resurfacing today. It's used by a lot of different practices. I use it a lot for the vertical lines around the mouth. It works really, really well. Mows the skin down. It basically shaves off all that discoloration, fine lines and wrinkles, and exfoliates the skin. New skin comes through, is looking much more supple and clear. But again, you need to suppress, because if you don't, you're right back to square one. So always, always combine these lasers with good, solid, active skincare. It's too big of an investment. You're going through this big downtime. It costs a lot of money. And then, you know, if you go back to square one, you're bummed. But if you can take a big jump start to your skin and then continue on with the skincare, might be the last laser you need for a very long time, if ever. Our practice has shut down. I'm not exaggerating. We used to use the Contour TRL at least once or twice a week. Today, most of my patients are, you know, as they're waiting for their vertical restorers, they're on the trifecta. They might be on it for 6 months, 9 months. And even though we suspected that they would benefit from the laser at the time of their consultation, they show up for their surgery and their skin looks too good to do the laser. So the skincare can do amazing things if it's the right skincare. And I hardly do the laser in our practice today. I mean, maybe last year we've done it once or twice, whereas like I said, we used to do it all the time. So it's a testament to the power of skincare, but it's also a testament to, if you use these lasers, you can really hold off on needing to do them again and again, which is time consuming from a healing point of view. It's costly. It's a lot to go through. It's no fun healing from a laser. I mean, if you've ever seen what that looks like, it's not good, but the rewards can be very, very good. And in the right hands, very low risk. Next is Botox. Now, when I say Botox, I'm talking about all the neuromodulators, right? Xeomin, Daxi, Dysport, all of them fall into this category. I'm just gonna say Botox because that's the most brand recognized neuromodulator. Definitely is not going anywhere. A lot of beautiful uses, glabellar lines, forehead lines, crow's feet, fine lines around this area, lip flip, corners of the mouth, a lot of indications for how it can be used effectively. There is no substitute. There's no surgery you can do to replace the expression lines. And the whole idea, just so you know, about Botox is the skin thins as a result of all the things that we just mentioned. Normal aging causes it. As the skin loses elasticity and collagen, it wrinkles more every time you express. So as a result of that, every time you express, lack of elasticity and the collagen in the skin causes that line to go from what would normally be like a smooth forehead to eventually having lines on your forehead, around your eyes, even when you're not squinting or expressing, because you go from a dynamic line to a static line because there's lack of elasticity in the skin. So as a foundational thing, this is the reason why 20-year-olds don't need Botox and they express just as much as everyone else, is because their skin is thicker and their subcutaneous fat is better. But what you really want to do is maintain and improve the collagen production, elasticity, and all those things that make skin youthful and more supple. The need for Botox becomes less. This is something that people don't think about, but you use Botox because your skin is aging. Now, to keep a line or wrinkle from turning into a permanent line, you gotta stay in front of it. So that means you gotta do the Botox on a regular basis, 3 or 4 months at a time, to keep that area from developing. Now, I use Botox for this area here. Now you can see I can still move it, but if I didn't, the line would be much deeper. I just want to take the power out of that area. I don't care if it moves. I just don't want it to form a deep crevice there. And if you use Botox in that way, you need less of it just to take the power away from those expressions and keep the line from going from dynamic to static. But I love Botox. I think it's very, very safe. Personally, it's been, I've evaluated it all. My wife has been on it for at least 20 years. I've been using it on and off for probably the same amount of time. The literature is stacked with long-term studies with it. So I don't see an issue with it personally. So again, your choice. People have some issues with using it, but again, I don't consider it to be an unsafe product to use. The next category is fillers. Now, you've heard me say a lot of negative things about fillers. And when I say that, I'm talking about how the filler is used. The filler in and of itself, it's a volumizer. So there's specific areas of the face that could benefit from some volume. It's just that the way most fillers are used, by putting it in the cheeks or putting it along the jawline to try to replace the need for surgery, it ends up making the face look weird, puffy, deformed, etc. We've seen it all. What I generally use fillers like these days, if you have a small line or a crease, your lips are a little thinner, temples are a little bit hollow, you need a little augmentation of the chin to bring it out a little bit because you have a little bit of a weaker chin, or like a small deformity here and there, there's a lot of value. Even under the eyes, a small amount can make a big difference in a younger person when it's just volume loss. But once you get older and it's a lot of volume loss and skin laxity and all these other things, it just doesn't do the job anymore. So I like filler as a tool for very, very specific things. It's just not used the way it's mostly used. And again, watch that video that we just published and some of the other videos and you'll understand what I mean by that. It's just not meant to be used that way. And we've learned the hard way over the last 20 years. Final category is facials. I'm a huge fan of estheticians and facials because anything that's gonna put focus and concentration on the skin and skin health, I'm a big fan of. I think estheticians really do a great job of educating and taking care of skin using light chemical peels, exfoliating treatments, cleaning out pores, etc. All these things are valuable to the overall look and complexion of the skin. No matter what though, again, same thing, the common theme. You can have a facial once a month and do that forever. It's still not gonna take the place of daily skincare. So using the skincare in addition to getting facials, you're just getting better results than you would just otherwise. So I think it has a place. Hydrofacials falls into that category too. My wife Netta had been using them for a long time. She was dedicated, like every 4 weeks, she was getting her hydrofacial, really loved the outcomes. I think it's a great treatment, nothing wrong with it. A little bit of chemical peel associated with it, a little bit of pore vacuuming, cleansing the skin, short treatment, low downtime, no downtime really, low risk, high upside. So facials, hydrofacials, all solid treatments. All right, that's my list. That's the list of things that I think are very, very useful and good and worth your time and money. If you're using them in conjunction with sun protection and skincare, you're gonna see even better results. I hope this gives context. I hope this gives you direction as you're planning your own strategy to defy facial skin aging and recognizing where everything fits in. If you have any questions or comments, drop them in the comments below. If you enjoy this video, make sure you like it. Share it with some friends and family. Let's get the word out. And make sure you subscribe to the channel so that you can continue to see these types of videos week after week. In addition, make sure you sign up for the KaramMD Journal, which will be delivered free newsletter to your email. Great topics, in-depth conversation about a variety of different things related to skin and facial rejuvenation. And for more information, check out our websites. All right, folks, I hope you enjoyed that. Dr. Amir Karam.